Welcome to the second video in our series on labor positions. This series explores ways to help the baby move through the pelvis more easily, reducing the risk of you needing a C-section as well as reducing the risk of extensive tearing. This video is going to focus on early or latent labor. I'm Jeanette Schmidt, the nurse educator for Parkside OB-GYN. Let's get started. During early labor, your baby will most likely be higher up in the pelvis, and this area is referred to as the pelvic inlet. The baby is going to be moving further into the pelvis, getting ready for birth. So, what else is happening physically during this time? Most likely, your baby is going to be head down. Your cervix is also starting to change, it's dilating and effacing. And when you're in early labor, that's actually defined by the cervix being dilated just 0 to 4 centimeters. And during this time, your baby is in the minus station above the ischial spines. Your water may or may not have broken. You may be feeling contractions that are pretty spaced apart, usually more than 5 minutes apart. And if your pregnancy has been low risk, you may be able to spend a lot of this time at home laboring comfortably. So, the pelvis is actually more flexible than many people think. It has joints that are connected with cartilage and it can move quite a bit. The red circles here show you where the ball of the femur locks into our pelvis. And how we position our knees and our ankles actually influences the position of our femur, and that affects the pelvis. Let's learn to use that to our advantage, right? Let's hear what Dr. Romeo has to say about this.
So in early labor, when you're about 0 to 4 centimeters dilated and the baby is high up in the pelvis, we really want to open that pelvic inlet. The way we do that is by having our knees wide and our ankles close together. That allows the baby to engage in the pelvis and move down to the next station of the mid-pelvis. When we want to engage the baby in the inlet, we want these top portions of the hips to open this way. And we'll do that by having our knees wide and our feet together.
In this example, you can see Dr. Romeo's knees are far apart and her ankles are close together. She's on the hands and knees position. You can also put a birth ball or an exercise ball underneath your chest to provide some support, and that can reduce some of the pressure on your wrists in this position. Here you see Dr. Romeo in a seated position on a chair. Her legs are out wide, her ankles are close together. In the hospital, this could look like you sitting on the side of the bed. You could be sitting on a chair, or you can also be sitting and bouncing gently on a birthing ball. In this early labor position, you can see again, her knees are apart, her ankles are together, and she is demonstrating a squatting position. At the hospital, they can put squat bars on your bed, and that can allow you to squat comfortably with support. Even with an epidural, you can still optimize your pelvic inlet. The pillow shown here between Dr. Romeo's legs simulates a hospital pillow or even a peanut ball. Your nurse can help you get into position by placing a supportive device like this between your knees, and then your ankles will naturally fall together. Thank you for taking the time to watch this video. Be sure to keep an eye out for the next video on active labor positions.